Hello, I am Paolo Gisondi. I am professor of dermatology at the University Hospital of Verona, Italy. Welcome.
Thank you, Professor Paolo. My name is Zhou Yuan. I'm a dermatologist from the second affiliated hospital of Zhejiang University. I'm so glad that here is a crosstalk with Professor Paolo.
Also me, I'm very happy for this. Thank you.
So nice to meet you.
So nice.
And we know that Professor Paolo have a lot of work and study on the early age of psoriatic arthritis and got a very simple and very useful psoriasis arthritis questionnaire for the clinical and for the patients. So for this one, I have a question that, and we know that the early age of the psoriatic arthritis, it's very hard to diagnose it, just have the skin inflammation. So is that possible from a biomarker? Maybe ultrasound, maybe MRI, or maybe in the blood test to help us
of course.
Before the symptom got arthritis.
Oh yeah, thank you for the question. I think that we are quite sure that normally firstly appears psoriasis and then appears psoriatic arthritis. So psoriasis is one of the major risk factors for the future development of psoriatic arthritis. This is according to the line, to the time, right? So we dermatologists are in a right position, privileged position for the early recognition of psoriatic arthritis in the early phases that we can call prodromal phases, we can call preclinical phases, we can call early phases. Let's have a discussion regarding the name, but the meaning of the concept is that psoriatic arthritis could develop progressively in patients with psoriasis. How to identify? I think that firstly is the clinical symptom that should guide us to suspect the possible development of psoriatic arthritis. Because psoriatic arthritis is not clinically evident, symptomatic, is not an issue for the patient, we are not allowed to treat. We are focusing on the skin. So I think that firstly, we have to ask the patient different questions in order to suspect if there is an inflammatory joint process undergoing.
Thank you. The second thing that I wanted to ask is that we know that you said the psoriasis will have possibility to develop to the psoriatic arthritis.
Yes, absolutely.
Yes. So is that crosstalk between the skin inflammation and the joint inflammation, the cooperation? So we know that if the psoriasis treatment will be well done, maybe we can stop development.
Yeah, thank you, because this is a very crucial point. We know that there are several risk factors for patients with psoriasis to develop PSA. Which are these risk factors? Firstly, the skin disease severity, the PASI score. How bad is the skin involvement, so the severity of psoriasis. Secondly, obesity. Obese patients are more at risk for future development of psoriatic arthritis for many reasons, including the fact that obesity is a trigger for the enthesis, is a biomechanical stress for the enthesis, and then obesity is associated with a low-grade inflammation. Nail involvement is another risk factor because of proximity with the joints, and then positive family history of psoriatic arthritis is another risk factor because of likely the genetic predisposition of the patient. Some of these risk factors are modifiable. I mean that dermatologists could do something to modify this risk factor. What? For instance, treating the skin. Treating the skin effectively is reducing one risk factor. The other, treating the nail, is reducing the risk. The other, dermatologists could promote weight loss for the obese patient. weight loss, weight control. We can do this one. Of course, we cannot change the genetic background, but we can modify these risk factors.
Yes. Why I ask that? Because our team, our laboratory team and clinical team also focused on that study, and we published one article months ago on the JCI, and we found that the skin inflammation will crosstalk with the joint inflammation.
Yes.
And we also found one candidate biomarker is a kind of clone called CCL8.
Very nice.
So we wanted to do a very earlier stage psoriatic patient. We want to find them. Maybe they will develop the arthritis. We want for this patient, maybe they don't have the symptoms, but the biomarker is higher. We want to do the JAK inhibitors, like the biologics for them, very early stage for them. That will be benefit for them.
Okay, if there is no arthralgia, I think that the diagnosis of psoriatic arthritis is doubt, is not sure. So I think that we dermatologists are visiting a patient with an early prodromal phase of psoriatic arthritis that are patient different compared to those patients that are visited by rheumatologists, because rheumatologists visit the patient when psoriatic arthritis is already fully expressed, of course. However, we need criteria, dermatological criteria, to identify these patients. We have criteria to identify patients at risk, as I discussed earlier, but all these studies you mentioned are very valuable to identify biomarker, of course, but I think that we as a clinician, tomorrow in the clinic, visiting the patient, we have to deal with symptoms of the patient. And of course, arthralgia, pain in the joint, is one of the major biomarker, live biomarker of the disease.
Thank you above all. That's so nice to meet you.
Nice to meet you. Nice to meet you. Thank you for the interview.
I learned a lot from you.
Okay, thank you. Thank you for the interview.
Thank you, Pauline.